I suppose the assumption for reducing costs is that we will be able to provide the same type of care in 10 minutes rather than 15 minutes.
Patients here at the Britannia Medical Clinic got a letter advising them about some changes to how they're going to be treated following proposed changes by the UCP government. The letter outlines how the government's plans will affect their healthcare experience, most notably 10-minute appointments. Clinic owner Dr. Matthew Henschke says the way doctors are compensated for appointments that run past 15 minutes are being eliminated.
For 25 minutes, a family doctor would be paid the same as if they were spending 15 minutes with a patient. From a clinical perspective, I'm one of the clinic owners at the clinic here. We were looking at our finances of keeping the clinic open, and that would actually prevent us from being able to cover all of our bills.
He says gross billings could go down 30 to 40%, making it tough to keep the doors open. The letter and a tweet put out today also got a lot of traction as it revealed seniors' driver's physicals would now be out of pocket.
The going private rate for a senior's driver physical, or driver physical in general, is $150. And one of my 79-year-olds, she actually is looking like she's going to have to start to budget a little bit, because being on a fixed income, that's a surprise bill that she wasn't expecting to have.
Henschke also says that changes to the Good Faith Billing program may also leave many of our vulnerable citizens out in the cold. The program would allow primary caregivers to be reimbursed for those who may not have a health card but are believed to be Alberta residents.
If all of a sudden we're saying that we are not going to provide primary care to this vulnerable population, the only place that they can end up is going to be in the emergency room, in the urgent care center, and then that care that they're receiving is going to be even more expensive than if it was just provided from a primary care clinic in the first place.
Henschke believes that these cuts, which are meant to cut costs, will only cost us more in the end.
We'll see shorter but more frequent visits. And so the billing likely isn't actually going to change a whole lot. What we're going to see, though, is a lot more disruption to people's lives where they're having to take off more time to get to the doctor.
He's asking his patients and others to forward their concerns to the Minister of Health. In Calgary, Tara Overholt, City News.